Good morning. I'm Dr. Jay Anderson of Anderson Family Chiropractic in Naturopathic Care, and this is my beautiful wife, Ariana, and she is a naturopathic doctor, and here in our office in Waterville, Ohio. And today we're come to you to talk to you about building a strong immune system and how to stay healthy naturally. And it's some of those things are on what makes our office a little bit different than a lot of other different offices. Is it just on how our approach is towards getting healthy and staying healthy. Our idea is to not suppress the immune system, but to rather make the body's defense mechanisms stronger to help prevent, and better handle the different ailments that we come in contact with, if it's colds or flus or whatever it might be. And with whole food nutrition, that is a very essential part of our bodies that we need. It's not just from getting just little snacky foods here or there, but it's just things that actually our body needs as opposed to what it wants. And so as we go through today, we're going to touch on several different topics in nutrition, a little bit of chiropractic, and so one of the things that we'll talk about too is our immunology. And so what happens then is we always think of our immune system as kind of like a organ, or just one particular thing that actually makes our body healthy. Well, it's actually a multi-functional system that does it. It's multiple different organs, multiple different cells. It's not just one thing. Some of the things that are in it happen to be like the thymus. And we always hear of like lymph nodes. We think, okay, that's our immune system. Well, that's only a small part of it. We also have like tonsils and adenoids, spleen, appendix. Yes, we do need our appendix. We don't just need to take it out. It's not just some remnant type thing. It was put in there for a purpose. And also bone marrow. Yes, bone marrow does help our immune system. And so there's so many other different things that we can talk about that on this topic. And but with a video that Dr. Ariana has put out online, we'll go into much more detail. And but at this point, I'll turn it over to her to go into more detail on what she's going to talk about today.
I'm going to talk about just 3 main highlights of the lecture. And again, our lecture is it's about a half an hour, and it's out on our YouTube site, which is AFC Space Wellness, and so if you want a deeper dive, you can go out there. But today we're just going to highlight some of the main points. The big 3 of the immune system we're going to talk about. So the first is your first line of defense, which interestingly, most people don't think of as being part of your immune system, and that's your stomach acid. So your stomach is made to be a pH, down to about 2, which is very, very acid. And so if you can imagine, you eat something and it's got bacteria or fungi or protozoa or something in there that's not really supposed to be in our internal environment, it gets burned up in that acid. The problem is that a lot of people have depleted stomach acid due to improper diet, age, drugs. And unfortunately, the acid that you need is not going to be found in stores. And we have a whole lecture on digestion that goes into this. It deep dives this, and so we're not going to do that today. But I will tell you that oftentimes the symptom of not having enough acid feels like acid, right? So that acid reflux, and it seems that doesn't seem like that could be so, but it's really that it's not acid enough in there, and because it's acid, maybe a pH of like 5. It's not acid enough, and so it's not breaking down proteins properly. And also, it can let pathogens into the intestines because it's not acid enough. So if you are interested in learning more about that, let us know, or you can go on our YouTube channel to see more detail about digestion. So that's our first line of defense. Our second line of defense is white blood cells, which you're probably familiar with. If invaders actually do get into the body, so they pass that first line of defense, then your white blood cells begin to attack. And ionizable calcium is actually the best way to assist these white blood cells, which a lot of people do get enough calcium in their diet, But guess what's needed to ionize calcium? Stomach acid. So if you don't have enough acidity in the stomach, it's really difficult to ionize the calcium that comes into your diet. So points us right back to the first line of defense, that we need to make sure that we have proper acidity in the stomach. And so another part of that second line defense is inflammation. Inflammation goes hand in hand with those white blood cells. It releases chemicals called histamines, which you're probably familiar with, which begin that inflammatory response. And there's a lot of things that happen in that cascade, but some of the main things is your capillaries are going to dilate, and then white blood cells are going to flock to the infected area, like sharks to blood. I mean, it's just like that. They go after it. And the goal is to collect, inactivate, or destroy dead or damaged cells and or foreign particles. And they do it very efficiently and very well. And this sets the stage for your body to come in and then repair those tissues. It's important to note that inflammation is natural. That is a part of the second line of defense, and it should not be suppressed. There are some rare exceptions where that process is not supported properly in the body and it goes rampant, but by and large, that inflammation is a part of the immune process and it should not be suppressed. There are proper vitamins and minerals to allow the inflammation to occur as it should. And these are vitamin A, vitamin C, and bioflavonoids, specifically those found that are called rutin. We have supplements that have those nutrients, but there's foods that you can add into your diet to help this, and that's really a better strategy that we try to move patients towards, to have those foods just in their diet so that they're getting those nutrients in on a regular basis. The third line of defense is, and actually most infections don't ever get to this point because, the stomach acid and then the white blood cells do their job. But when they do get past those two, then B cells are needed to produce what are called antibodies. And the B stands for bone, as he had mentioned, the bone marrow. And our immune system starts in the bone with those B cells. And healthy bone food is needed, and this includes calcium and other minerals. And so those are the three highlights to the video that we talk about, the lecture. And again, if you want more detail, you can kind of go into that. But those are our big three. So Dr. Jay's going to talk a little bit about some tips and techniques for prevention.
Yeah, so preventing from getting sick or ill or anything like that. Number one is what I recommend is chiropractic care. So it's very, very important, very important. And it's and what chiropractic does is it actually helps the brain communicate to the rest of the body, and not just of the pain in the back or pain in the neck. It goes towards every organ, tissue, and cell in our body. That includes all those organs that I listed before, like the thymus and bone marrow and all that stuff, appendix. But yeah, so we want to make sure that communication is working properly. Minimize stress, reduce stress, especially now. There's stress all around us, but we will never get away from it. But what we need to do is choose our battles. We need to make sure that we're saying, okay, do we need to really stress about this, or do we need to pray about it and let God handle it, or just let it go. Eating proper foods, just like Dr. Ariana had said, eating more fruits and vegetables, getting the right types of proteins. That's better than supplements, but if you don't get enough of that good food, then we need those supplements. And stop smoking, right? I mean, they've been telling us that for years. And they even put it on the package. Will or may cause cancer. I don't know. Makes sense to me. Reduce alcohol intake. Minimize exposure to chemicals. Like lawn fertilizers and pesticides, herbicides. There's different chemicals in our houses that like cleaning products. We need to reduce those. Still clean, but just not use the super toxic ones there. And also exercise and walking. Get outside and walk. Get sunlight, sunshine. Get proper sleep. Drink a lot of water, good water. What we should do is drink at least half our body weight in ounces of water every day. And so let's say if you weigh 100 pounds, you should drink 50 ounces of water a day. Or if you weigh 200 pounds, you should drink 100 ounces of water every day. And that just it just helps hydrate everything in your body, every cell, including our spinal discs there too. Important. And also reducing sugar. Sugar is delicious, but it's bad. It's bad. But Dr. Ariana, we'll talk a little bit about on how bad sugar is.
Yeah, sugar. We're moving into sugar season, right? With the holidays, but sugar can cost you more than your teeth health. At an average consumption rate of 130 pounds of sugar per person per year, sugar takes the cake. Cell-mediated immunity is depressed by 50% for 120 minutes after sugar ingestion of just 75 grams. And why is this? They actually did a study on this where the issue, how we know that if it goes down 50%, is that vitamin C and sugar and glucose will compete for absorption in the cell. And that was done in a study in the American Journal of Clinical Nutrition called Depression of Lymphocyte Transformation Following Oral Glucose Ingestion. And so think about that, 75 grams, if most soft drinks have 12 or more teaspoons of sugar per 12 ounce can. So if a teaspoon has 3 grams of sugar, each can has 36 grams of sugar. So just two pops will decrease your or soda, whichever one you say. Yes.
Whatever part of the country you're from.
Yes, carbonated drink full of sugar. That it will depress your immune function, for 2 hours. So think about that. Like, a lot of times when people talk about, if they have their tummy's upset or whatever, they'll have ginger ale. It's probably not a great idea unless you're actually making that from a natural soda and not putting sugar in there. Sugar is one of the worst things that you can do, especially if you're dealing with, an immune challenge. So cutting that down and or out as much as you possibly can over the holiday season will behoove you, and that we're moving into a season where people oftentimes get colds and flus. And so I'll just end it on one last thing, because a lot of times people ask us what nutrition is best to take during this season. And definitely vitamin D. So if you can get out in the sun, that is best. I know it's tough when it gets cold. That is going to be your best form of vitamin D. We do have a really good whole food form of vitamin D here for patients that come to our office. Please let us know, and we can certainly recommend that. But keep in mind, the best possible thing you can do is get to the sun. Vitamin C and vitamin A, which I touched on a little bit earlier, those are absolutely essential for our immune function. And you can get this from your food. You really can. It's just that we don't eat enough of it. One thing that would be great to add into your diet on a regular basis, even a daily basis, is red peppers. Red peppers are full of vitamin A, vitamin C, and bioflavonoids, which all three are needed for a proper immune response. And then, of course, second best, you can ask Dr. J or I. We do have some supplements here that are whole food. Again, we're a whole food shop. We like things that actually are just concentrated food pellets. But we use oftentimes a supplement called Immuplex or Conjuplex, and those are multivitamins for the immune system that can assist you if you're falling short in some of the phytonutrients that you should be getting in your diet. Zinc. For those of you that come in, especially to my office, I poke people all the time to eat what? Does anybody know? Pumpkin seeds. Yep, pumpkin seeds. Green pumpkin seeds. Sometimes they're called pepitos. They are full of zinc, and I would recommend people having 2 tablespoons of those a day, every day, for the rest of their life, because zinc is just not in our soils much anymore, and so it's not in our food, and most people are severely deficient in zinc. So eat pumpkin seeds every day. I've noticed that a lot of foods are starting to have them in that, and that's really good. because zinc is absolutely essential for the immune process, which a lot of times with some of the things that are going on right now, people are aware of, or a little bit more aware that zinc is so important, and it's just unfortunately not in our food. So stay positive and healthy, and as he said, make sure you get good sleep and good rest. Anything else you want to close with?
I guess just listen to your body.
Yeah.
It's constantly trying to talk to you, trying to tell you what you need to do. Listen to it. If you need sleep, go to bed.
Take care of yourself.
If you're thirsty, drink water.
That's right. That's right. Well, you guys stay healthy out there. Thank you for tuning in.